The internal medicine residency program at Augusta University provides exceptional training for our categorical and preliminary residents. We know that where you choose to do your residency training will impact the quality of care that you provide for your patients for the rest of your career. This is a critical decision for you, and I'm delighted that you're looking closely at our outstanding residency training program. We are a medium-sized program. We have about 70 residents all told, and we really think this creates the perfect environment for you to have mentorship, individual guidance, and tremendous opportunities to participate in research.
I don't feel like I'm a number here. I had interviewed for other residency programs where there was just so many residents that your coordinator wouldn't know your name, or you wouldn't have a relationship with the attendings. I feel like every attending that I've worked with here, I've established some sort of relationship with.
When I was looking for a program during my interviews, I was searching for a few things. Number one, I wanted to be in an academic center, surrounded by a strong medical school as well as research opportunities. With those included would also be fellowships that I could possibly pursue. One of the great assets of this program is that our campus is quite robust. It includes the Medical College of Georgia and dedicated research. The hospital itself is a level 1 trauma center with recognized stroke and chest pain centers. But despite its large size, the residency program exhibits a great balance that provides individualized attention.
While many of our residents pursue fellowship training, about 80% over the last several years, I'm equally as proud of our residents that have chosen to pursue primary care as a career goal for themselves. The fellowship training opportunities are important for us to cultivate and create outstanding fellowship applications for our residents that have applied and successfully achieved fellowship placement at outstanding institutions all over this country.
They have a really high match rate for fellowship. They work really hard to try to get you into whatever field that you want to pursue. If you want to be a cardiologist, they'll help you get research. They'll help you find a mentor that works for you.
One of the distinctives of this residency program is the simulation lab and our dedication to creating ultrasound-trained clinicians. From early on in our training, residents here are given an ultrasound probe and models to practice on. We practice on patients in the hospital. We use our educational skills and also practice on ultrasound technique in our outpatient clinics. We provide exceptional, well-rounded, comprehensive training for central line placement using ultrasound guidance. Our residents graduate very fluent with the use of bedside ultrasound and are quite comfortable with its application. In addition, we offer an outstanding economics course that teaches our trainees about the ins and outs of the finances of medical care, from the Affordable Care Act to single-payer healthcare systems to why that Band-Aid costs $16 in the hospital. We want them to be well prepared as they enter the world of care, whether it's in private practice or in academic centers.
When I came and interviewed here, it just felt really comfortable. I felt that they were trying to see me as a person. It just seemed like they wanted to get to know me and they wanted the best for me.
Everyone is very nice. It's a comfortable learning environment as you're working with a team. You have a lot of oversight with the attendings, fellows, and upper-level residents, but maintain a lot of patient autonomy. And you're comfortable asking questions, and you're always learning on rounds, and you also round with NPs or PAs, the pharmacist, and they bring a lot of unique insight to the different aspects of a case.
Being an advanced stage, typically stage 4, and most often associated with lung cancer, breast cancer, and lymphoma.
One of the great features of this program is the 4+2 schedule that definitely attracted me to this place. For 4 weeks, consecutive weeks, our residents have the luxury of focusing only on our inpatient responsibilities. We don't have to worry about covering our clinic inboxes because we have full coverage there. And so we're able to really focus in and treat those patients.
COPD.
Yeah, hold Oliver in our hypertensive right now, continue her anxiety.
And at the end of those 4 weeks, we transition to 2 weeks where we attend our own clinic, full day clinic, 1 day a week. And then we have weekends that are free. And during that time, it just makes us feel like a full person. We have time that's dedicated to our families, but also it gives us the opportunity to really focus in on our patients.
My favorite thing about Augusta is being outside. There's great outdoor activities here.
The town is beautiful, from the canal where we can canoe on a weekend to the many restaurants and cute little diners and little shops that we could explore.
Our residents all get together outside to spend time with each other, do fun activities, and there's no shortage of great places to hang out, restaurants to go to, or other cultural things you'd like to see.
I also wanted to go to a place where the residents really enjoyed each other. It worked as a team, and one of the first things I noticed when I came here on my interview is the camaraderie of our residents.
I also just really like that everybody's really close-knit here. I've made a lot of friends that I will keep for a lifetime.
There's so many people from so many different walks of life and cultural backgrounds and nationalities, and it's just an awesome place to work.
My particular privilege and joy is in working with the outstanding individual residents that come here to train. Watching them flourish in their times of sometimes stressful training and become outstanding clinicians and educators and researchers in their own right has been a joy that has given me more satisfaction than I ever could have imagined. We're delighted that you're looking at Augusta University. I look forward to the opportunity to meet with you.